Okay, so let's talk about cesarean scar mobilization. After a cesarean birth, we have a scar. It's usually lower. I just drew a pretend one here so you could see better. And what can happen over time is that scar tissue can build up and it can create some stickiness, some adhesions, some tension, which certainly can happen in the abdominal wall, but it can also impact the pelvic floor, our hip flexors, how we breathe, and even how our low back moves. So there's a lot that can happen if we don't give our cesarean scars a little bit of attention. And most of us don't get that information after birth. So once your scar has healed, typically 4 to 8 weeks, so 6 to 8 weeks is tissue healing time, okay? But you can start it a little bit before that and work on either side of the scar without touching it as it heals. So if you're very early on, what you're going to do is you're going to take your fingers and you're going to make little circles. And you, of course, if your scar is still healing, you don't want to be right on that scar, but you can move. I'm going to move my hand so you can see, but you can start to move the tissue around the scar in those first few weeks. And then if it's tolerable, you can even sink a little bit deeper. And my knees are bent because my scar is still healing and your body is still healing from birth, so we're not trying to create more problems and more pain for you, okay? And then you can even do circles in the opposite direction, okay, just to start getting things moving a little bit. Now, once your scar is healed and things are feeling a little bit better, what you can do is you can straighten your legs, and we are going to do the same movement, little circles, and you're going to do this closer to the scar, okay? So right now we're doing the top layer, okay? So you're not getting very deep right now with this. Now, what I like to do also is a little bit of almost like a cross friction massage. So I'm holding one side and I'm massaging, and I'll go on either side of that scar. And I could feel even down here, so technically where I am is a little bit above my cesarean scar, it's low, and I can feel some tension there. And then I'll come to the other side, and I'm going to go the opposite way to start with. Now again, if your scar is healed, I like to go on either side of that scar and kind of pull in opposite directions. And what you'll notice is you'll find an area that maybe feels a little tighter when you move one way or move the other way. And if that's the case, you're going to spend a little bit more time there. And you're going to maybe go pull one hand to one side, the other going the other way, and then you're going to switch. You can even do some gentle stretching of the scar. So scars are three-dimensional, and the fibers are going in many different directions. So that's why we're doing circles, and you can switch your circles and you can do side to side or maybe up and down, because we want to make sure we're getting all aspects of that scar. So after you've done your circles, you've done some gentle massaging on either side, going over the top, over the bottom, and then maybe even done some little crisscross stretching. Then you're going to do what we call skin rolling. So skin rolling is just picking up that tissue and pulling, okay? And if it feels okay, you can even literally do some rolling. Okay, but what we're doing is we're just pulling those layers gently upward. Okay. So it's very gentle. Now, the next step is we're going to bend our knees. Okay, this is going to let us sink a little bit deeper into the muscle layers. So now, when you do your circles, you're going to sink a little bit deeper than before, and you're going to get onto those muscles. And you're still going to go on all sides of that scar. And what you'll notice is a lot of times on the edges of the scar, right near your hip flexor muscle, it'll be tense and a little bit tender. So you can get in there, you're going to move up and down, you're going to move side to side, and you can even hold, kind of put one hand on that muscle and massage in different directions as you pull with that anchoring hand. Same thing with this. You can do circles, you can reverse your circles, you can also get in and gently move that tissue up and down. So once your scar is healed, you're not going to hurt yourself. I suppose you could if you went a little bit crazy with it. But we're just gently getting all of those layers of tissue moving. So really sink down in there as long as it feels okay. And with this one, I'm not going to do so much of this with these deeper layers. I am going to move side to side and up and down, but I'm going to do it more locally. Now, sometimes this can really help with urgency. If you're feeling like you have to pee all the time or you just can't make it to the bathroom, a lot of times tension in these muscles, whether or not it's a result of the cesarean scar or not, can be contributing to that. So this can certainly help with urgency and frequency, as well as scar tissue mobility. So if you have any questions or concerns, always find a pelvic health physical therapist to help you. I am more than happy to help you find one in your area. But the bottom line is, once your physician has cleared you and they look at that scar and they say everything looks beautiful, it's well healed, we should all be working on our cesarean scars. In the first few months postpartum, you can do this every day for 3 to 5 minutes a day. And then as we age, in the maintenance phase, you can do this up to twice a week. And what I like to do is every few months, I'll spend several nights in a row and I will work on my scar and I will give it some TLC. And I can tell that that really is helpful in my low back and in my abdominal function and in my pelvic floor. So I know that if my scar is getting a little bit tense, it will increase my leaking, my abdominal muscles won't work quite as well, and my back will get a little bit sore after I work out. So I know that it's time to give my scar some attention, and that is very helpful. So this is something that you can do forever. You don't have to do it every day forever, but it's something that you always want to pay attention to and think about, because it can certainly play into a lot of issues all in the hips, pelvis, abdomen, ribs, and even your mid-back. So if you have any questions, please send me a message or find a therapist to help you. We are experts in postpartum care as pelvic health physical therapists. So we're more than happy to give you some tips and walk you through it and make sure that it is something that is safe for you to be doing. And good luck with those cesarean scars.